Hey, welcome to the Right PT Show. Look at that. Jinx went to the first unit. Hey, welcome to the Right PT Show. I'm Dr. Tyler Billings, co-founder, Doctor of Physical Therapy. This is Kate Anderson, partner, Doctor of Physical Therapy, recent OCS certified. Yes. We've been talking about this in a few of our Facebook Lives that you've taken that exam. So Kate is now an orthopedic certified specialist. We're going to get to that in just, let's just jump into it right now.
Sure,
let's talk about, Kate, what is an orthopedic certified specialist? What does that even mean?
Yeah, you'll see it a lot of times. A lot of times people have letters behind their names, right? So anybody that has a doctorate in physical therapy and is a licensed physical therapist will have a PT, DPT behind their name.
Yeah.
Then you might see additional certifications behind that. The most difficult and grueling one, kind of the top that you can get within the world of physical therapists, physical therapy, is a board certification in a specialty. And so they have those for orthopedics, they have them for neurology, they have them for sports. There's a lot of different types that you can get. It's a pretty grueling process to get it. You have to pass a very difficult test. Yep. But once you get that, you are then board certified. You're considered an expert in the field. Very few people have it. It's like less than 3%, I believe, if I understand correctly. And so there's some good things that come from that. And so we're excited because, within our organization, we have six doctors of physical therapy that are board certified. And 2 days ago on Tuesday, we actually got results back from everybody that took it this last year, and found out that we have 6 new board certifications within our company.
Doubled.
So we have doubled. We have gone from 6 within our organization to 12 within our organization.
So we have doubled. I know a lot of people pivoted when COVID and the pandemic hit. Kate and I got together and said, hey, we're going to pivot here. And so because a lot of the continuing education was difficult to get to.
They were holding common courses.
So we shifted, and now we put our efforts on being board certified clinicians. So that's amazing. We doubled our orthopedic certified specialists. So you can know you're in good hands. What does that mean? Well, you got a lot of OCS PTs, top of the chain, right? In the orthopedic world, that is the top that you can get as an OCS certified PT that sit at the helm of our quality committees, and they help develop protocols for us. So we use those OCS minds to really give you the care that you deserve. So we're super stoked.
Yeah, we should give a shout out to those that passed.
Yeah, so let's go. First of all, Kate Anderson.
Let's do it. Yes, I'm in the Twin Falls area. I work in the Twin Falls clinic on the corner of Falls and Locust. Also within the same clinic, Dr. Jess Jackson. She passed and is now OCS certified. At our Kimberly clinic, Dr. Kevin Cherry was able to pass and is doing great things at the Kimberly clinic. Very excited for him. One of the best therapists I know, one of the best guys I know. Just an incredible guy. In the Cheney clinic, which is Twin Falls, on the Cheney, Dr. Joel Brown, one of my favorite people in the world, and probably the most photogenic person in our company, because there are pictures of him everywhere. Dr. Joel Brown is now OCS certified.
Mr. Twin Falls High School.
Mr. Twin Falls High School, right? I don't know what year it was, but Mr. Twin Falls High School, he's a big deal. Dr. James McMurray in our clinic on Stillhead Way in Boise. Young therapist, very young therapist, and very rare to see somebody that young, and so obviously doing some incredible things in Boise, beyond his years. And then Dr. Shane Searle in our Rupert clinic, who also is just doing incredible things in the mini Kaja area. And so we're super excited. Did I miss anybody, Rebecca? I want to make sure.
I think you hit them all.
I think I hit them all because I'm going to be in huge trouble if I forget anybody.
Brian Wright, right? CEO, who's also OCS. James Wood, who's OCS.
And Hammond.
John Barker.
John Barker and Jerome. We have Xavier Beckham up in Meridian. And I feel like
I think we got you covered. I think we got you covered on board
Alex
specialty.
White. Dr. Alex White.
That was close.
He probably watching it. I know. That would have been really bad.
Well, congrats to all of them. It's super exciting because it just shows the commitment at Right PT.
Oh, Dr. Reagan Ward, Kimberly Clinic.
Now we're fully committed. But the commitment that we have to really getting you back to what you love and getting to the root of your pain. So let's talk today. We went to our OCS group. We talked to them. What questions are you getting from your patients? What do you hear a lot from? And the question here is, what do I do about my MRI? Should I get one? Should I not? So we put here, you are not your MRI. So the question is, do I get an MRI? Is that helpful? What does it tell me? I don't think you've been hiding under a rock if you don't know that MRIs have like quadrupled in cost. No matter where you go, I mean, they are like quadrupled in cost. So we always talk about as clinicians, an MRI, magnetic resonance imaging, right? So basically it goes in, takes a deeper look at the soft tissue. You can look at the disc, you can look at the tendons, you can look at the ligaments beyond what an x-ray can do, right? An x-ray is going to really be more superficial. Look at bones, right? Where you can see there's a bone break or a fracture. That's pretty straightforward. MRI gets at the deeper level, but they can also be misleading. That's why we say you are not your MRI, right? I know of 2 physicians that I'm friends with that said, hey, you got an ACL tear in your knee, anterior cruciate tear, looks like it, feels like it. Do the MRI, we shoot the image and say, yep, there's no ACL there. I don't even see an ACL, so for sure we're going in there. And I got a call from both of them. I opened it up to do surgery, and boom, there was an ACL. Right?
It was there.
So the MRI picks it up like no ACL, it's gone. They're confident. They go in and like, holy smokes, there's an ACL. So what I'm not saying is that MRIs are bad, because they're definitely part of the diagnostic paradigm, how to diagnose, but they're not the end all be all. Yeah. Right? We've seen this for years and years and years, where you look at an image and a lot of people want to point to the image and go, right there, that's the problem. And what happens, Kate talked about this last time, they wake up from surgery from carpal tunnel, right? We'll just use our last Facebook Live. They wake up from carpal tunnel and they're like, I still got numbness into my hand. But the MRI showed, hey, there's some narrowing in the tunnel. Well, that's part of aging, right? Yeah. We all narrow. Right now as we speak, our backs are just narrowing with the disc fluid, right? As we get older, right? Yeah. That just happens. So that's an interesting thing to think through. And a statistic I thought was really interesting. We just got back from this spine course. And in the spine course, they sent this image. They had someone go in for imaging on their low back, herniated disc, and they said, we're going to send it, I think it was 16, right? 16 radiologists. Yeah. Love radiologists. Well, I got a bunch of buddies at radiologists, but I thought it was interesting. They sent it to 16 radiologists, and 0 agreed on the same diagnosis. 0, folks. Yeah. Right? And I'm not saying it's bad to go get medicine and have radiologists look at it. I'm just saying that's what imaging does for you. Right? You can't look at the image and go, yep, we all got the same diagnosis. Out of 16, 0 agreed on the same diagnosis. Yeah. So as I talk about this, you can't say correlation equals causation. Right? You can't say, I see that little black spot, that means this. Right? So if I was going to give you a take-home message is, if you have a normal MRI, so in the research, if I have a normal MRI on Kate Anderson's back, I don't see anything, that's actually considered abnormal. Because everyone's so different, right? And in this study here of non-symptomatic individuals, means they don't have symptoms, 37% of 20-year-olds,
yes, young kids,
37% in this huge study they did had a disc bulge. At age 20, no symptoms, no pain. 80% in 50-year-olds, 80% of 50-year-olds, none of them had pain. They also found that those that had pain that looked like a possible disc bulge did not show signs of a disc bulge on the MRI. Yeah. Right? So they had the pain that looked like it, it sounded like it, and then they go do the MRI and it does not show that. So what does that study mean? That just shows a lot of you out there, even those listening to this right now, that do not have pain, probably have something going on with either disc degeneration, meaning the spine is narrowing, right? There might even be a slight disc bulge. That doesn't mean that's what's causing your pain, right? And so my take-home message here is aging is part of the process, but imaging alone cannot be relied on. So what can be relied on is a thorough physical examination. So we look at how the body moves, how it bends. It's going to tell you what is happening, right? This is why we go get certified in mechanical diagnosis, because we can tell through movement, and also a thorough subjective exam, right? Your medical history. Kate, tell me about this back issue. Like, when did this start? Tell me about the symptoms at night. How far down the leg does it go? Oh, okay, what causes it to flare? Like that type of subjective exam to say, show me where the pain's at, tell me how it's acting, then I do a physical exam. Then if I need to, right, if we get to a roadblock in PT and we're stuck, okay, then that's most appropriate to go do the MRI. But to start with the MRI is not the route to go.
Yeah, I think it's super important to understand, like, we see it visibly on the exterior of our bodies, the effects of aging. It's already happening to me. I'm in my early 30s. I'm already getting gray in my beard.
Buck.
I'm already getting some weird wrinkles and weird spots, right? I'm already like losing some hair up in here. Like, it's just, and you can see it, right? And you look in the mirror and see it. The same exact thing happens in the interior of your body, right? Like, the exact same thing's happening. You're gonna get narrowing of this. You're gonna get some arthritis buildup, which sounds like the scariest thing in the world. We're gonna have to do another Facebook Live where I tell you that it's not, in fact, right? Because it's a normal part of aging. It's no different than gray hair, right? And so you cannot say that is the cause of the pain. You just can't say. The research does not back it up that, oh, I see that, therefore that's the exact cause of the pain. And like Tyler said, there's just been countless experiences where people have gone in because they saw that on the MRI and said, well, it must be the pain. So they fix it, and guess what? It didn't take care of the pain. And so it's just super important to understand, right? And so another interesting thing about MRI is that, you know, there's a lot of research done on this kind of stuff, and it's out there for anyone to see. But, you know, patients who went and got an MRI first, meaning that was the first thing that was done once they went to a doctor, is like, well, let's get you in for an MRI. They, on average, spent nearly $5,000 more in associated healthcare costs than those that went to PT first.
Wow.
$5,000. That's crazy, right? Like, so I want to talk about why. I'd probably buy new golf clubs.
Would you have gone
really
to the
nice
NBA Finals to watch
I would
the
have gone
Jazz?
to the NBA Finals to watch the Jazz.
$5,000
if they weren't there.
Holy cow,
It's
that is
significant,
quite
right?
Will you repeat that again?
I will.
That
Those
is so worth
that the first thing they did was go get an MRI. They on average spent nearly $5,000. The exact number is $4,793 more in associated healthcare costs than those who went to PT first, right out the bat. And there's a lot of reasons why. There was a huge study done. We're talking with like tens of thousands of people, right? And one thing they found is that the quicker you can get somebody in to a physical therapist, right, like after the injury happens or after the pain stops, the better outcomes you get, right? The reason why is because, and we can go on and on, this isn't a low back pain topic right now, but when you get low back pain, the very worst thing you can do is quit moving, right? The very worst thing you can do is just start putting a band-aid over with opioids or whatever it may be. Like, you got to get moving and you got to get the problem figured out. And the longer you wait, the worse the outcomes are, is what they found. And so ideally what they showed, the best outcomes when you get low back pain is you get to a physical therapist to get moving within 3 days of the onset of the pain, right? The longer you waited, the worse it's going to be. Now, if you get sent for an MRI, you got to get it scheduled. That's going to be probably 2, 3, 4, 5, 6 weeks in advance, right? And it's going to take a week to get the results back. And then you're going to sit and deliberate over it, and then you're going to have this like period of like, oh my gosh, I got diagnosed with degenerative disc disease, and so you're going to go into like mourning for a few days, and then they might say, well, do you want to do PT or do you want to do surgery? Next thing you know, you might end up in PT, you might just go straight to surgery, and you don't know if that's really the problem. But if you do make it to PT, it's 7, 8 weeks down the road. Your outcomes are already way worsened at the fact that you waited that long to get to PT.
I hope you're hearing this. Like, when the quicker you get in, the better results, the better you get out of pain, per like thousands of people that we're studying, and you're saving at least $4,950 in overall costs.
Yeah. It's a big deal. So, and some of the scientific reasons why it gets worse over time is that people can develop what are called fear-avoiding strategies, meaning that they're fearful to move, right? And when you're fearful to move, we've talked about this in other Facebook Lives, but if you're not moving within the joints, you're not getting that fluid movement throughout the joint that gives nutrition to the joint, that helps it stay healthy.
Yeah.
You're not pumping blood flow in the area to help improve things. You're going to get stiff, you're going to get rusty, it's just going to cause you problems, right?
Yep.
And so the worst thing you can do is just be fearful, like, oh, I hurt my back, I'm waiting for my MRI, so I actually can't pick that up, my back hurts, right? I'm just going to sit in my rocking chair and retire because I can't golf anymore, like whatever it may be, right? Like, that's the worst thing you can do, so it leads to worse results. You've got to get moving, and I think one thing that's really interesting, there's something in the medical field called clinical practice guidelines, and what clinical practice guidelines are is it's put together by massive amounts of research and expertise within the field, right? With people that are board certified or whatever it may be, and they put together, hey, when you've got low back pain, for example, these are the top things that you should be doing, right? These are the things you should avoid. They give a level of evidence on all the different interventions or things that you could possibly do for a wide variety of different diagnoses or issues that you might have in your body.
Yeah.
I think it's very interesting that the clinical practice guideline for physicians say that when you have low back pain, for example, number one, you should get into physical therapy because you got to get moving. Number two, you should be manipulated, meaning what we affectionately call pop and crack. It's a grade 5 mobilization where we go in there,
Some might
mobilize
call
that.
it adjustments out there in the world. That's a whole nother topic that we'll get into.
But popping and cracking, that's the way I like to kind of describe it. The third one would be general health improvements, meaning improved sleep, improved exercise, improved diet. Those are the top 3 things that you should do. The issue is that a lot of people, their go-to is medication and MRI. And that just isn't backed up in the evidence. And so, super important. What I love about that, those top 3 things, they're all things that can be done by a physical therapist. We have the ability to manipulate a joint. We have the ability to know when it's appropriate to do that.
Yes.
We have the ability to educate. We understand how the body works. We can educate on how to improve your sleep, how to improve your exercise, how to improve your diet. And we have the ability to obviously get people moving and do that in an appropriate way that's under an optimal load, right?
Wow.
And so, to me, that's the takeaway. If you've got low back pain, if you've got knee pain, like whatever it is, handle this the correct way. Going to get an MRI or going to get put on medications is not the best way. It's not the best way in the research. It's not the best way in my expertise and my experience that I've seen. I've just seen it countless times that the quicker you can just get somebody in, look at the way they're moving and adjust that from the get-go, the better off you'll be. I'm going to calm down for a second.
Calm down, take a breather. Get out of here. Just kidding. Hey, that was super well said. You can come back in. That was super well said.
Thanks.
Take home message here. We'll just wrap it up. We could go on here for days. But the take home message is you are not your MRI. The first step you should be taking is going the route of physical therapy. If it's an orthopedic issue, the first step you should take is PT. A thorough subjective exam, a thorough physical exam, shoulder, whatever, neck, let's see how you're moving, let's see what's going on. Then, if you need to, then you go the route of an MRI to get a deeper look at what's going on. And that has its place, right?
Yeah.
We see that. Probably happens about less than 5% of the time, right? Maybe less than 10%. They have their place. Like when your physician's ordering an MRI, it doesn't mean that's bad. But if it's your first route, is what we're saying, it's going to lead you to more cost, and it's going to lead you to slower progress to getting back what you love.
Exactly. Rebecca, are there any questions? We got Rebecca in the background.
We have none from the audience. I have one.
Please.
Rebecca, this is Rebecca, by the way.
Why don't you come join us?
Rebecca, come on over here.
Yeah, come join us.
Do you think she can just hide out in the back?
I try. If you have been formally diagnosed with degenerative, hardest word for me to say ever,
Yes.
disc disease, is that something that PT, if you incorporate that into your life, can keep that from progressively getting worse?
Yes, and so that goes
Good
right
question.
on. That's a super good question because that's what we get. Like, sometimes we'll get medical intake forms, and people will be like, "Well, I got diagnosed as April of '93 that I got diagnosed with like degenerative disc disease," as if it was like cancer or something, right?
Yeah.
Like, and that's not the case. What we're saying is that you can get diagnosed with that because they saw it on an MRI. It doesn't necessarily mean that's the cause of your pain. First of all, right? And so that's the first answer to your question. The second would be, yes, we can help it from getting worse because a lot of times that comes from wear and tear because you're probably not moving the way that you need to. And so we can absolutely do that. And third would be like, yeah, like when you get diagnosed with something like that, it doesn't just necessarily mean I will have pain the rest of my life because the truth is when you get degenerative disc disease, again, it's gray hair. the only way to get rid of gray hair is to go dye it, right?
Yeah.
I'm not gonna go in and like, I guess we could go in and like pump up the fluid and like get rid of that. It would be the equivalent of dyeing it.
Yep.
But you're not gonna get rid of it. But all that means is that you've got a little less room for error, if that makes sense. It means that there's narrowing. So that didn't cause the pain, but there's a little less room for error. So if you're not moving correctly, or if there's some weakness somewhere, whatever it may be, it's gonna have a more profound effect. if
And I
that
think
makes
also
sense.
like what Kate's saying, like the aging process inside the body, it's like wrinkles on the inside of the body. Like when he talks to gray hair, like if someone has a wrinkles on the cheek, you're not quite there yet. Definitely not Rebecca. But the
You got
wrinkles,
some
I got a little right here.
there, yeah.
But a wrinkle that'd be similar in asking like, hey, are you gonna be able to smile again? And am I gonna be able to like function the way even though I have wrinkles? Like, well, of course, right? And can I change wrinkles? Probably not unless I do something really extensive and
Yeah.
get really weird and you look like Michael Jackson by the time you're done. But does that make sense? So degenerative disc disease, like what he says there, you're not gonna change what it looks like on an MRI, but how you feel and how that joint moves, right? And a PT's not just gonna teach you like, hey, here's some exercise. It's gonna teach you how to lift and how to function in a better movement pattern. So the degenerative disc disease doesn't become relevant, right? It's just an image on the screen. Does that make sense?
Gotcha. Yep, absolutely.
Good question.
Rebecca,
Good to
great
know.
We should
question.
have you more often.
Rebecca, I like this. Well, hey everyone, thanks for joining us. Kate, congrats again,
Thank you.
OCS.
Yeah.
Appreciate you watching the show. If you have any questions, ripept.com. Look us up at one of our 14 locations. Peace out. Have a great day.
Yep, thank you. Oh, let's